Thank you all for having me today. This is just to say that everything that I'm talking about today are my own findings and my own thoughts and opinions and don't represent HRSA or anybody else. And so I'm going to be talking today about parent-mediated interventions. And so we know that interventions for young children with autism are increasingly incorporating parent-mediated treatment as an intervention delivery mechanism, and that the feasibility of these parent-mediated interventions is well established in the literature. So we see that parents gain skills, and we find that they are reporting satisfaction with the training that they receive. But when we look at the evidence of efficacy of parent implemented interventions, or like how well they're working for the kiddos, we find more mixed results. And so part of the issue is that we aren't sure what the most important pieces are of these parent implemented interventions when we think about achieving optimal child outcomes. And part of the reason for that is that there isn't a uniform way that we are teaching parents to implement interventions. So for today, I'm going to be focusing on just two theoretical approaches to interventions. So that's going to be structured behavioral interventions and naturalistic developmental behavioral interventions, or NDBIs. So in more structured behavioral approaches, which are based in applied behavior analysis, parents are not learning the same strategies that therapists are using. It's not that same comprehensive package. What we do see is that they're learning to manage challenging behavior through positive behavioral support strategies. And they also learn functional communication strategies as well. So different ways that they can help increase language levels with their kiddos. Now in NDBIs, these often focus on increasing the sensitive and responsive nature of the interaction between the parent and the child. And then within those sensitive and responsive interactions, they incorporate those ABA strategies in order to increase learning within like a dyadic interaction. So in the NDBI models, parents are generally learning a simplified version of the strategies that are utilized by therapists. So both structured behavioral and NDBI approaches are integrating parents into the child's therapy, but they're differing in the mechanisms of action and how they would then be executed, right? So they're focusing on different things, with the NDBIs looking more at the quality of the relationship between the parent and the child. So what I'm going to be presenting today are findings of part of a larger study where I'll be comparing different intervention strategies across approaches. But for today, I'm going to be focusing specifically on sensitive and responsive parenting interactions and how parent characteristics interact with the intervention condition to affect change in those parent behaviors over time. So to our knowledge, no studies have compared parent implementation of adult-led structured behavioral and NDBI interventions in the past. We do know from developmental studies that increases in parent-sensitive and responsive behaviors have been linked to more positive outcomes for children with autism, but there's been little attention paid to how those parenting behaviors might vary as a function of the coaching approach and the parent characteristics of the parents that are involved in the coaching studies. So this project utilizes data from Dr. Rogers' large multi-site randomized control trial, where they compared the efficacy of two interventions for children with autism. So they looked at the Early Start Denver model, which is an NDBI, and then a program for discrete trial training, or DTT, which is a highly structured behavioral approach. So participants in this study were children between the ages of 12 and 30 months at study entry. The average age was about 25 months when they entered. And the kiddos had to have a medical diagnosis of autism. On average, the sample was white, with about 53% being white, and it was primarily male, or 75%. So children in the larger study were randomly assigned to receive either DTT or ESDM delivered in-home by skilled clinicians for 12 months. Now, parents received coaching for about 3 hours a month by a master's level clinician for the duration of the study. So again, for an entire year. In the ESDM condition, parents received training and coaching in the manualized parent ESDM model. And in the DTT condition, coaching focused more on behavior management and eliciting communication. But in both groups, this was high-level coaching. So parents received reading materials. They talked about their child's treatment goals at coaching sessions. They had access to data collection strategies, and they were getting coaching in their direct implementation of the different intervention strategies. So they got coaching while they were actually working with their child. The DTT condition in this group can be thought of as what you might find in the community practice that incorporates parent-implemented intervention or parent coaching. But again, this is all very high quality. So in this study, we compared data from 87 parent-child dyads, and we coded 289 videos of parent-child toy play interactions. And we looked at them across 4 different time periods within that 1 year. So we coded them using the Piccolo, which is a checklist of 29 developmentally supportive parenting behaviors for children in 4 different domains. So affection codes for items related to the parent's warmth and their physical interaction with the child. Responsiveness codes for items like the parent's attention to the child and whether the child follows whether the parent follows the child's interest, and then how they respond to the child's initiations. Encouragement looks at things like whether the parent uses pauses to give the child time to process and respond, and then also how they verbally respond to the child's attempts to do different things. And then teaching looks at parent labeling, how they ask the child questions, and how they respond to the child's questions. So each of these domains has roughly 8 items on it, and they're scored on a 0 through 2 Likert scale. And then those are summed to give a score for each domain. And in the end, you get an overall score of parent sensitivity and responsivity that averages between, that ranges between 6 and 58. So for this age range, a score of 49 is considered a high score, and a score of 33 is considered low. So we conducted repeated measures random effects models to look at change over time in parent sensitivity and responsivity. And so we're going to look at the overall trajectory of change and various parent factors that are associated with those trajectories. But today I'm going to be focusing on maternal education, just in the interest of time. Other factors that we're looking at, though, include things like parent age, race, ethnicity, the number of kiddos that the parent has, and things like that. So this is a breakdown of maternal education for the sample. So you can see that in the some college or below, in the high school or below, it's a much smaller group. And so that is a limitation of this study, but we did feel like there was enough difference theoretically for us to separate that group. But I'm open to feedback at the end if you think I should collapse. And so we found a significant interaction of time by treatment by maternal education. So what we found was that mothers with high school education significantly differed from mothers with some college education. And so within the high school educated group, we see that on average, the DTT group gained about 14 points over the entire year, while in the ESDM group, they averaged about negative 0.5 points of change over time. So those two things were statistically significant, so those are different. And the trajectory of change for the DTT group was significant, but the 0.5 points of difference for the ESDM group was not significant. There weren't really any other significant differences between groups, but we can see here in the Some College group, this came really close to being significant. So the difference in the trajectory of change between the two groups was almost significant. The ESDM group averaged about 6 points higher in change over time than the DTT group. So all of this matters because when we compare the learning patterns of parents coached in different intervention approaches, we have the opportunity to better understand how best to support parents of children with autism. And this information can be used to streamline parent coaching strategies and hopefully decrease the burden that is so often placed on families when they receive a diagnosis and get a ton of information about what they need to do. So overall, mothers in the sample are starting with relatively high levels of sensitivity and responsivity, which is really nice to see. These skills also remain fairly constant over time or improve. So this suggests that this is an area of strength from which parent coaching programs can work. And so just as a reminder, 49 is considered a high score. So you can see most of the families there met that, and 33 is a low score. So when we look again at this high school group, especially for the DTT families, we see we find that maternal education level might be an important factor in determining optimal strategies for supporting parents. So the DTT conditions started lower, but they also had the most growth, meaning that it's an area that we can affect change in. So I would just like to end by thanking my mentor, Dr. Stamer. I'd like to thank Dr. Rogers and the entire Tadpole team for allowing me to use this incredibly rich data set. I also have an incredible team of undergraduate interns who coded over 400 videos as part of this project. And I want to thank the LEND program for an amazing experience. So thank you.
I have a question.
Yes, Sally.
Thank you, Sarah, for that lovely presentation. I'm thinking about the high school or less education group, which is the only place we really see a difference. Mm-hmm. And you were interpreting the effects in terms of the level of education. But I'm wondering about looking at it from the point of their initial score. It seems like the change is coming from families who are have great difficulties with sensitivity and responsivity. Mm-hmm. And so I'm wondering whether another way to interpret that particular analysis would be that for families who have have great difficulty with that skill at the beginning, that DTT treatment may be particularly effective. I don't know how many families you have in that group or how many got each, but it seems like the group that begins at kind of your average level, no matter what treatment in the other cells, they don't change very much. So I just am wondering about whether that's another way to look at this analysis in terms of baseline point at the start.
That's great feedback. Yeah, I will definitely look into that. I want to understand more for sure about the families who started so much lower and to just see if there's like any factors that might be associated with that would kind of help us like look at where to explore. So mm-hmm. I'll definitely. Thank you.
Thanks for that lovely job, Sarah.
Thanks, Sally. Thanks for letting me use your data.
I'm delighted you're in your data.